of home tips from PKL Physical Therapy while we're working out what's going on right now. Frozen water bottle, you don't want to fill the bottle up all the way. Stick it in the freezer for about an hour or so. This is great for plantar fasciitis. What you're going to do is just place it on the floor, put the arch of your foot right there, and just roll. It's a nice ice massage right at the bottom of the foot, getting right along that plantar fascia. Alright, this next round of exercises that we're going to do are great for keeping up your leg strength to help prevent any falls. This one is standing hip abduction. You'll be in front of a counter, elbows on the counter, leg coming out to the side, back in. Just like so. That's going to be 3 sets of 15. You're going to feel it right on the outside of the hip here. This next one is hip extension. Again, standing in front of the counter, you can be bent over with your forearms here, or you can have your hands tented like so. Leg stays nice and straight up off the floor, going back, and then back in towards the counter. This is going to be 3 sets of 10. This next one that we have is going to be a standing ham curl. Same exact position. You're going to pick one foot, let it hover up off the floor, and then bend that knee, curling back, getting right in the back of the thigh. Also, 3 sets of 10. This next one is going to be a standing calf raise. It's wonderful for your calves, and it's great also if you have any plantar fascia issues. Coming up, and then slow down. So you don't want to drop down. Come up, and then drop down slow. 3 sets of 15. This next one is called a single leg stance. It's wonderful for balance. But you want to make sure that you're standing in front of a kitchen counter so you don't wobble all over the place. Tenting your fingertips on that kitchen counter, you're going to pick up the good leg and balance. You're going to count to 30 or set a timer if you have one. And you're going to hold this. As soon as the timer goes off, put that good leg down, take a minute to rest, and then do it again. Do this at least 3 times. These next ones are squats. If you would like to challenge yourself, I recommend having a chair behind you, arms out in front, sitting your butt towards the chair, and then holding this for 5 seconds. Working on some balance, working on those hamstrings. Pressing up through your legs to stand. 3 sets of 10. This next one, for those of us who don't really like that much of a challenge, are sit to stands. Starting seated in a chair in front of the kitchen counter. If you need, your hands will go on the kitchen counter for balance, pressing through your feet to come up. Once that starts to get easy, no hands. Pressing through the feet, coming to stand, and then back down. 3 sets of 10 for any of those squat options. These next exercises are called hip abduction spreaders. They are meant to target the outsides of the hips. You're not going to see a lot of movement here, but if you're doing it correctly, you're going to feel it all through here. Positioning, feet are going to be about hips width apart. Once there, you're going to press the outsides of your feet into the floor, engaging the outside of the hips. You might feel a little stretch on the inside of the thighs, but this is where we're targeting. Holding that for a count of 5, 3 sets of 10.